someone wanted to know about radiation optic neuropathy. And radiation optic neuropathy is an optic neuropathy. So from a clinical standpoint, you're going to have decreased visual acuity, a nerve fiber layer defect on the visual field. If it's unilateral or bilateral but asymmetric, a relative afferent pupillary defect in the right or left eye, depending on which one's affected. And the field can be any type of field defect, ranging from chiasmal type field defects to optic nerve field defects. It can be unilateral or bilateral, and the nerve can look normal or it can have optic disc edema, but usually nerve is normal. If there's radiation retinopathy, it looks like diabetic retinopathy, multifocal hemorrhages. However, most of the time the fundus looks normal initially, but the nerve's going to turn pale eventually. The distinctive feature is you have to get the history, and the history is going to be they had prior radiation therapy. Normally, there's a delay, like 12 to 24 months between the radiation therapy and the development of radiation optic neuropathy. So it's not an effect that occurs like the next day after radiation or even weeks after radiation therapy. It really takes a while for the radiation endotheliopathy and vasculopathy to occur. And the dosage is important as well as the parts that were radiated. So we'd like to go get the radiation record and see how much radiation the nerve actually received. And the way to make the diagnosis is MRI with gadolinium, which is going to show the distinctive finding, which is enhancement of the nerve. So if you have an acute or subacute loss of vision, RAPD, and optic neuropathy findings, history of radiation therapy, especially 12 to 24 months ago, get the dosing and the protocol, what was radiated, doing an MRI with gadolinium, and we're looking for optic nerve enhancement. It might be a little bit enlarged as well. The treatment is controversial because nothing really works. Steroids in the acute setting, hyperbaric oxygen has been tried with variable success if it's been given early enough. Avastin, bevacizumab can be given, but really nothing really works for radiation optic neuropathy. But you should be able to diagnose it, recognize it, and then give it a treatment trial.